Afternoon. I'm sorry to interrupt briefly your lunch. Please continue to eat, and I love all of the conversations we're hearing taking place at tables, and I hope that's continuation of some fantastic discussions and deliberations that took place over the past few hours, which we can't wait to hear about. We just have about less than an hour, so I want to make sure we get started now. I'm going to get a few sort of housekeeping notes out of the way, and then we'll get started with the readouts from all of the fantastic breakout sessions that just occurred. Many of you have signed up for a tour this afternoon. I know that's going to be a fantastic outing, and I wish I'd be able to join you. Just a couple notes on that. The tour, you should meet at the lobby, the main hotel lobby at 2:30. But before that, stop by the registration desk, because if you've signed up for the tour, you've been assigned to a bus, so you can get information about those bus numbers at the registration desk just outside here. Women, please be sure your attire is appropriate, meaning that your skirts, dresses, pants are full length, shoulders covered. We will have scarves available for the women attending the tour, and you should be back here by about 6 p.m. And if you need any help in coordinating here, Shama, where are you? Can you stand up so everyone knows? Don't see her at the moment. Okay, so you'll find Shama out by the registration desk as you are assigned to the bus number. So wonderful. Well, again, I really hope that the last few hours have been productive and fruitful. I managed to stop in during most of your discussions and heard a lot of great new ideas and productive thought process happening. And of course, the idea here is that while we have the COP28 planning team with us, we'd love the opportunity to hear what you all talked about, hear how consensus and alignment is developing over the course of those conversations. So we have 4 sessions to do. That'll mean we can spend about 10 minutes on each breakout session, which I know will not be adequate to do justice to the depth and breadth of the conversations that you all had. So we will certainly be following up with the hosts of each roundtable session and distributing a more comprehensive sort of distillation of those conversations that happened. But to get us started, we will begin with the Beyond Early Warning Systems roundtable. And for that, I'm going to ask Dr. Kaushik Sarkar to come up and report out on those discussions. So Kaushik.
Thank you so much, everyone. And we really had debates more than discussion, and that's what we expected in the dialogue. I'll directly go to the next slide. Yes. I know that I won't be able to do the justice for the discussion that we had. We agreed to disagree on some points, and for that, we formed mechanisms that can help us to reach agreements. But these are some of the wordsmithing that we did at the end of our overall workshop. So the first point that we felt is critical is to have universal health coverage combined with early warning systems, and that S after the system is really critical because that's what the group focused on, so that we know that all types of early warning systems are taken care of. So universal health coverage combined with early warning systems and a framework for climate adaptation. And this framework is really not the framework which we have for the climate health program. This is more end-to-end solution focused. For example, data infrastructure and early warning systems framework that take into account collaborative human-centered designs. So by human-centered design, we mean that the communities and the scenarios within the LMICs need to be taken care of when we build that framework. Feasibility and absorption capacity of the LMICs. We heard a lot that the technologies that are being forced into the LMICs, they don't have absorption capacities to take that framework in. and building local ecosystems and capacities that have long-term co-benefits. For example, if a tool is developed within a country, taken with the guidance of the global development processes, so it will create local jobs, it will better local economy, and at the same time, it will improvise the country's development focus. And evaluations and phased scaling. So we heard cutting the corners and lack of proof of concepts, several clustered piloting doesn't help. So a focused approach, and that's why the framework is needed, that phased scaling can be done based on evidence. So that's the first recommendation. The second one is commitment to funding, without which it cannot happen. So commitment to funding for early warning systems, again, that S is very critical. Ecosystem and emergency operations center, because someone has to respond to that, and that center need to be cross-cutting. Advocate for funding of entire ecosystem instead of components, because right now what is happening is pilots are being funded or small duplicated initiatives are being funded. So data collection, storage, quality, management, governance, use, and evaluation, this in entirety should be looked into as a comprehensive collection, and that collection should be funded when we are considering early warning systems, ecosystem, and emergency operations centers. Next slide, please. Now, the key outcomes that we thought were provide incentive and mandate to countries. Right now, what is happening is whenever we are putting data globally, or the main challenge of data sharing, or rather exposing the local situation, is that countries are getting, or areas or geographies are getting disincentivized. So countries need incentive, and also countries will need mandate. So provide incentive and mandate for countries to work together on a framework for building global data, health and non-health. And non-health does not only include climate, it includes the entire spectrum of non-health that includes other social factors like the social determinants of health and many others. And that architecture and a coordinated response system. Right now, early warnings are being given, but focus is less on the response mechanism. The next one is again on the funding side. So funding for multiple climate-sensitive diseases, not one disease, or not siloed funding, as we heard yesterday as well, and coordination across donors on disease-focused areas. So this needs to be more kind of holistic for the sustainability of such frameworks and system that the group proposed. Next slide, please. There are certain initiatives, groups, and ventures that exist that can be tapped. One is Welcome and Gates venture that literally focus on gaps and limitation of adoption, and technology can be included, technology specifically for the climate health nexus. WHO TDR ED's warning system, World Bank Pandemic Fund, IMAX Expert Network, World Bank Digital Earth Partnerships, NASA Gates Venture, and WHO Vector-Borne Disease Working Group. So these can be tapped into in the lead up to COP28. And we also thought that formation of a working group, because the debates and disagreements never ended here, as I said at the beginning. So formation of a working group to debate a flexible global data infrastructure using cross-cutting data, challenging experts to work together across diseases. Plus, we also agreed that we will continue to follow up on the dialogues that we had today. So reconvening this group, follow-up dialogues with the existing workshop participants to continue. So these were the 3 slide takeaways that we had for the COP28 team. I'd be happy to answer, if possible, any questions that you might have. So what I heard from Kelly is we still have 3 minutes time, and if there is any question, and I know that this description does not include all of these that we have consolidated here, so a more detailed descriptor can go out. But till that point, if you have any questions, I'll be happy to explain what we discussed. And we can move back to the first slide if that helps. The third slide. First, second, and third. The next slide for this. Yeah.
Okay. Can you hear me?
Yep.
Thank you so much for the outputs, and it was very comprehensive. And one thing I wanted to ask is one of the key areas where there's a big lack in progress is climate finance, especially for adaptation. And one of the things that for COP27 and now towards COP28 is how can we accelerate climate finance, especially for adaptation, so that it is the same as mitigation. And in your perspective, how can the health argument, as well as the importance of funding early warning systems, can really push for more mobilization of resources for climate finance towards adaptation? Because so far, I think it's around 2%. And this can be an opportunity for that, but I'm also curious to hear what you think about that specific area when it comes to mobilizing climate finance for adaptation.
I won't share my perspective though, but I'll share the group's perspective, what we had. And we had a very trivial discussion around that. We talked about economics of scope and scale for the climate financing part of the early warning systems. So that is something to be considered alongside the early warning system global data architecture, if we at all agree for global data architecture and such kind of ecosystem. And when we focus on economics of scope and scale, we should prioritize, we should make it more flexible so that the fund can go where it can produce impact or it can make impact. So it should be data-driven financing rather than just funding a specific disease or for a specific cause. So creating the global pool and directing fund around that. So that's my understanding, and it might vary from person to person within the group. But that was my understanding from the group. Thank you. Okay, thank you everyone.